Well, if I hear about the FEMaLe project, I immediately think about using artificial intelligence to improve the diagnosis of endometriosis. So I'm a basic scientist who works in a clinical setting, or in a setting where many clinical questions arise. And I think my strengths are to build a bridge between basic science and clinical research questions. And regarding my personal strength, I think I'm a very persistent person. I don't give up easily when I'm interested in something, but I'm also a very flexible person. So I can change my mind if well, there's a change in the situation or in the research question. So I think these are my biggest professional strengths in general. And otherwise, I'm an expert in endometriosis research. I'm also a coordinator of research projects on endometriosis, and I have a strong interest in endometriosis. Yeah, I think I'm actually proud to be a female project advisor, and this means a lot to me because I'm in endometriosis research since about 15 years, and I think this is a truly exciting project which can really put endometriosis research forward. And I'm also happy to be in connection with the FEMaLe project because I'm currently the coordinator of another European project on endometriosis research, which is dealing more with translating basic science findings into a more applied setting. And furthermore, yeah, I like to be involved in the FEMaLe project. I think I can contribute with my knowledge on basic science. And I'm also very curious for the results of the project. And so I have a direct link to this project, and I can immediately hear about new findings that are generated in the FEMaLe project. Yeah, I think I can contribute to the FEMaLe project with my expertise as a basic scientist working on endometriosis. For example, I could give some input on the data sets that are analyzed within the FEMaLe project. And I can also contribute to the dissemination of results and spread the word on the FEMaLe project. As I mentioned, that I'm a coordinator of another European project, so I can distribute news on the FEMaLe project to this specialist consortium. And well, I can also contribute as a member of several scientific societies. For example, I'm the basic science officer of the endometriosis special interest group in the society ESHRE. I'm also the spokesman of German Endocrine Society for Reproductive Health. So there are many channels through which I can contribute and spread the word on the FEMaLe project and their results. Yes, so I think improving gender equality is, of course, a very important point. In our discipline, the number of female researchers and clinicians is traditionally very high, but at the leadership positions, it's unfortunately not as represented as it should be. So gender equality is clearly a very important point. And I think at this point, I can refer to our university. As most universities, we have a gender equality plan, but we also have specific means to promote gender equality. So we have a special fellowship program for female researchers called WIRE, Women in Research, which is attracting female researchers who have a promising career, who come from abroad and want to do a research stay in Germany. And actually, I had a fellow from this fellowship program, materials scientist, who developed an endometriosis in vitro system in my laboratory. So we even had fellowship recipient working on endometriosis. And furthermore, we have like a network for female scientists in Münster, which also includes training on career perspectives. And so we are quite active in this field. And among the scientists who have gone through my laboratory, I have three postdocs who got full professorships. There's three female postdocs who got a professorship after training in my laboratory. Yes, so as a basic scientist, I work closely with clinicians, and we are trying to translate our basic research findings into clinical practice if it's possible. But I have to say our research is quite basic, so it takes a few steps to bring it into clinical practice. But the communication with clinicians helps me to understand which research questions are really important and where we need solutions in the clinics. And this is sometimes hard to understand for a basic researcher for whom everything is basically interesting. So I try to focus in my research on the questions which need to be urgently solved. And this is, on the one hand, the diagnostic delay, and we can improve that by focusing research questions on improving diagnostics. And of course, finding alternative therapies, for example, more drugs against endometriosis, which can complement the surgical therapy. So this is the way where, or the area where I can contribute. Well, I see two areas where FEMaLe can make an important contribution. So one is by creating more awareness on endometriosis. And this does not only include the public, but several target groups, creating awareness among clinicians who may be able to improve the diagnosis and who are thinking about a possible endometriosis diagnosis when they see a patient who has rather unspecific symptoms. Of course, I mean awareness among patients who understand the disease better and who become aware of what is possible regarding diagnosis and therapy of that disease. And I also mean awareness among politicians who understand that this is an important area. So this all concerns the dissemination, part of the dissemination and creating awareness. And the other part is, of course, the science and the clinical impact that we are hoping for with the FEMaLe project. And there, I think that by integrating patient data and putting them into calculating and then putting them into an artificial intelligence setting, we can come up with a very exciting diagnostic tool that is really needed. And I'm really looking forward to progress in this area because this is very new, very exciting, and also very promising from my perspective. So I think there are probably two points which are important. One is, of course, the diagnostic delay, and this tells us that we need better diagnostic tools. And the whole field is looking forward to like a non-diagnostic, non-invasive diagnostic test, because currently laparoscopy is the gold standard, but it would be good like to have a blood test, for example, or some other type of diagnosis that is less invasive. And this could, of course, help to reduce the diagnostic delay. But apart from science, of course, the diagnostic delay could be well tackled by creating more awareness and being more aware about endometriosis as a possible diagnosis of a disease with rather unspecific symptoms. And I think the second point that is important, I think we need a bigger spectrum of drugs against endometriosis. Currently, we have the endocrine drugs, which do work, but they are associated with side effects. And it would, of course, be good to have more targeted drugs with a better side effects profile. And I think this is where basic research also comes in, and where I think we need more basic research to find more drug targets for the disease. I think the biggest gain point is to improve the quality of life of a very big patient group, because it's estimated that maybe up to 10% of women of reproductive age may suffer from endometriosis, and tackling this problem can really lead to big improvements for a very large group of women. And for me, this is probably the biggest and most important point. Well, maybe looking from a university perspective, I think a big focus is on treating malignant disease, which is in cancer, which is of course important. I'm also, apart from doing research on endometriosis, I'm also doing research on breast cancer and ovarian cancer, for example. But this sometimes, of course, this is a very important point. It's a life-threatening disease, and it's clear why there are priorities for this research area. However, this may lead to a certain neglect for other important diseases. And endometriosis has often been described as a disease without a lobby, and I hope that initiatives such as the FEMaLe project will change this. So I think we have to keep our eye open on other research areas, not only on oncological diseases. And therefore, this is an important area that should be strengthened. And furthermore, maybe I'm biased in that point. I think that more basic research is needed in this research area. At least in Germany, it's very clinically oriented. So we have a lot of funding for clinical research. But I think we also need more basic research in this area, basic and translational research.